Some of the focus on COVID is shifting to a global epidemic, AIDS. December 1st is World AIDS Day. News 12 New Jersey's Marcy Rubin explains the parallels and connections between COVID and AIDS HIV.
It's confidential. You get the results in 20 minutes.
The mayor of Rahway taking a rapid test outside Robert Wood Johnson University Hospital at Rahway, but it's not for COVID. This mobile unit is testing for AIDS and HIV.
I think it's important for everybody to know their status. With early detection, there are so many treatments that could be done.
The free testing is part of a World AIDS Day event here.
We are commemorating all of those that we have lost to HIV and AIDS, but also offering free tests, community resources, prevention, education, all of the things we need to make sure that we end this epidemic together.
World AIDS Day 2021 marks 40 years since the first cases were reported, when HIV/AIDS was considered a death sentence.
I can still remember the panic and the fear that we would go into these rooms and we would catch it, and that we were all afraid. No different than the pandemic that we're dealing with now, COVID-19. A lot of misinformation and fear around these viruses.
Research into AIDS/HIV has come a long way. There are medications that make the disease manageable, even help prevent transmission. And much of that science is now being used in our new fight against COVID-19. The rapid scientific successes we've seen during this pandemic gives more hope to an eventual cure, an end to the AIDS epidemic.
I have extreme hope for a cure to HIV one day, and I think we can't forget that is the goal. We do have testing, prevention, and treatment, but one day we have to keep our end goal as a cure for HIV.
In Rahway, Marcy Rubin, News 12, New Jersey.
More than 36 million people worldwide have died from AIDS-related illnesses since it was first reported back in 1981 and considered it a death sentence. But today, people with AIDS are living full and long lives.